So this is another cell therapy trial. This is a trial that I initiated at our center. It's a single center trial. It's a phase 1, again, looking for safety signals and making sure that this was a safe therapy, but also hopefully seeing effectiveness signal. One of the major challenges of haploidentical stem cell transplant, meaning using someone else other than a matched sibling donor or matched unrelated donor or cord blood, a mismatched donor in the family, one major challenge is relapse. Almost half patients in some of the important clinical trials that have been conducted to date will be expected to relapse. So how might we mitigate this relapse rate? Well, we've mentioned already here the incidence of graft-versus-host disease from cell therapies. Well, that occurs in stem cell transplant as well, including after haploidentical transplant. There's a population of T cells that makes up only a very small percentage of T cells in human biology called gamma delta T cells. And these T cells have activity against leukemias and other cancers as well. We know that very well from prior studies that have been published. And so we leveraged our increasing knowledge of how these gamma delta T cells operate and the fact that it appears they don't cause graft-versus-host disease, such that we take donors at the time that we're collecting their stem cells. We take their blood a week before we collect bone marrow from them, take their blood to the laboratory, isolate the gamma delta T cells, expand them, and then freeze them in small packages. Patient then undergoes a haploidentical or mismatched family donor transplant, and then at the time that their blood counts begin to recover and they're engrafting, we infuse the gamma delta T cells. We've treated 7 patients to date. No patient has relapsed, and we would have expected half of these patients to have relapsed at this time point. And we have patients, several patients who are beyond 2 years and continued complete remission, and it was actually quite safe. We did see some grade 1 and grade 2 graft-versus-host disease, all of which has been responsive promptly to steroid therapy.